before. And some children are not maybe able to understand why life has changed so much. So we are having children that present with a little bit more of irritability, particularly when there isn't that capacity to understand what is going on. There is a little bit of regression. They might be acting out behaviors, but then also their own anxiety, depression, PTSD, as we've mentioned, especially if you do have the situation where a family member is deceased, but as we've said, you're not able to grieve as usual. You're not able to see the loved one as you usually would under normal circumstances. You don't have access to the hugs to be comforted from family members and friends as usual.
Okay, thank you so much. Welcome to another episode of Health Talks, hosted by the Great Physician Ministries. Since the 5th of March 2020, our lives have never been the same since we've had COVID-19 in South Africa. We will all agree we've at least lost a loved one, a grandmother, a mother, a father, a brother, a sister. Some have lost their jobs, and definitely all houses have been infected or affected by COVID-19. To help me talk about COVID-19 and mental health today, I have two guests, my friends and my colleagues, Dr. Idorenyin Akpabio and Dr. Darlene Boakye. Welcome, docs.
Thank you very much for having us.
How are you, Idi?
I'm good, thanks, and you?
Okay, thanks. And Darlene, how are you?
Great, thank you. How are you?
Okay, thanks, guys. So we'll talk about COVID-19 and mental health, obviously how it has affected us as a nation, as a people. But just to help us to understand what COVID-19 is, just to go back to the basics, we have Dr. Boakye. What is COVID-19, Dr. Boakye?
Thanks, that's actually a great question. So COVID-19 is essentially a respiratory illness and specifically a virus. It's kind of rocked the world by storm for a matter of months, where it was discovered in China in November 2019. But the main thing is it's a viral illness, and you get really like flu-like symptoms. It could be like any respiratory illness that you might experience in the past. You might get a sore throat, you might have a fever, some headache, tiredness or body pains. Sometimes you even get loss of taste, loss of smell, and a stuffy nose, even a runny nose, and diarrhea and vomiting. So those are very non-specific symptoms, but that's essentially how COVID can present.
Yeah.
It can come in any kind of way. It could even just be a very, very mild sore throat, and you might actually end up having COVID.
Yeah.
But there's a spectrum from mild to severe COVID, essentially. So obviously mild are the symptoms that I described a bit earlier, and severe is when you have, quite short, you are short of breath. And some people are actually reliant on oxygen supplementation, and they have to be admitted. And that's what we're now seeing in Gauteng, where we're having massive amounts of people that are being admitted to the hospital. And the main symptom is shortness of breath.
Yeah.
Their saturations are low, and they need oxygen essentially to survive. So essentially that is what COVID-19 is. It's one of the new, or actually rather an old coronavirus.
Yeah, it's over a year now.
Over a year.
Yeah.
But I mean other viruses like SARS and MERS, have occurred in the past. So it's not really new. It's actually an old virus that has been spreading over a period of time. And the main mode of transmission is through, respiratory droplets.
Yeah.
So if I'm speaking to you and I'm speaking to you and I don't have a mask on, it can spread very rapidly.
Okay.
And also with touching, surfaces, and if I don't wash my hands, it can also spread to us. But the main driver of coronavirus being transmitted is essentially by respiratory droplets. So that's why, I mean, obviously, the president has come across to say we should all wear masks, even though it's not mandated in other countries, but I think it's for our own health and well-being. So essentially that is what coronavirus is, and everyone is dealing with it. We'll go into a little bit more detail of it.
Thanks, Darlene. So we are currently dealing with third wave. We've seen the first wave, second wave, and I must admit it has brought a lot of anxiety, strain, psychologically, mentally. And Heidi, what are you seeing in your practice as a psychiatrist?
So with regards to the COVID-19 pandemic and mental health, one can, divide it into the direct impact it's having on people, and then an indirect impact on people. As we are still in the pandemic, there's new evidence coming out, but so far what we are seeing is that there is an increase in new mental health illnesses in people that were previously not having any conditions at all once they have got this diagnosis of COVID-19. So we are having new onsets of depression, new onsets of anxiety. People are struggling with memory problems. People are struggling with fatigue, also insomnia and confusion for other people. And this is especially so when they have a more severe case. So the patients that are being admitted to ICU tend to more likely have these conditions. And then there is also some people that have this PTSD associated with the condition, because you are in an environment where you are struggling. Perhaps you've been previously well before, and now you are fighting for your life, as it were.
Can imagine.
And some patients have had the misfortune of seeing others around them dying, and that can be traumatizing. And as you can imagine, it strikes in you the fear and anxiety that you could be next. So those are things we're seeing. We're also seeing new onsets of psychosis in individuals that previously weren't affected or had any kind of predisposition to such conditions, and that is now on the side of the patients. But we are also having clinicians that are affected. Maybe you'll weigh in on this, but we are seeing that our colleagues are struggling with anxiety, depression, and they also have PTSD and fatigue.
Let's go to the physician, Darlene, as a frontline worker. What are you guys, some of the challenges you're struggling with?
So I mean, we've been dealing with COVID since essentially March 5th, 2020, and that's been over a year. And at this point, we're experiencing our third wave. And during these waves, we get peaks of multiple of people, being admitted to hospital. And that means longer hours. That means, working harder. That means doing a whole lot more and being under a lot of strain and stress. So we're seeing a lot of, people who are actually, breaking down essentially and not being able to cope with, seeing firstly so many patients, and secondly also seeing a lot of people die, and you can't do a lot to help them apart from doing as much as you can within your capacity. So a lot of people are also, as you said, getting depressed, but not from the patient side, but from the doctor's side. And it becomes quite difficult to cope, and some are on anti-anxiety medication. It's just a lot on doctors because of every wave that we do experience. There's something new that's coming out, so it's quite intense on us. And so we're obviously trying to be patient with every patient that we do see, but it can be quite difficult.
In fact, we've never had to deal with so much death, as doctors, certifying
in a short
period. It should be a lot for most clinicians. And to echo Darlene's sentiments, it's a lot.
It is.
It's a lot. And which is why we then, depend so much on the services of the psychiatrists to help us navigate some of the challenges. I mean, one can imagine coming to work 8 o'clock, you have to certify 4 people before you get on with your work. So, Heidi, from your experience, just tell us, what are clinicians going through? What have you seen?
I think it's basically what Darlene is saying. This high patient load, this feeling of helplessness. Not as doctors, what we want to do is to help our patients, and you have a high number of people with a high number of ill people with limited resources. There's only so much one can do, and I think one is having to face the fact that they're not superheroes.
Absolutely.
So you are losing patients, and sometimes one doctor can lose several in one day, and that hurts, because we do care for our patients. So we have been in positions where we are providing debriefing sessions
Yeah.
for the doctors so that they are able to talk through
Sure.
what they're going through. But as you're saying, people are having breakdowns, there is fatigue, people are taking a break from the profession as well,
Yeah.
because it's just so taxing. It really
It's
is.
very taxing. So whoever's listening, we're not only highlighting problems, but we're trying to bring solutions. So
Yeah.
we will definitely touch into some solutions as to how one can navigate all these problems. It's one thing to point out problems, but we obviously have to come with interventions. And another thing we have underestimated the contribution of this working from home. Other people have small kids at home, they can't focus, they're having Zoom meetings, people are walking around. What's your experience about that?
So this is the other aspect of,
Yeah.
of COVID and its effect on the mental health. Maybe before we go there, I did just want to say, so we have this direct effect of COVID on the patients and the clinicians.
Okay.
But even around that, you have the indirect effect where if you are unwell, you're having to be isolated.
Yeah.
You don't have that personal support as you usually would if you were sick in other situations. And this is hard for the patients, but also hard for the family members, because you having your family member taken away from you, having to, if it's very severe and they're in hospital,
Yeah.
you don't know, are they okay? And because things change so quickly,
Yeah.
you could have spoken to your family member in the morning and an hour later you're being given bad news, and that is what some people are having to go through. This not having closure,
Yeah.
with their family members. So that is a problem. And then as you've mentioned now, people are having to work at home because of having to be, the social distancing and so on. Previously, you were able to separate your work from home, you go to the office, you deal with whatever you have to deal with, but you know that whatever time, I'm heading home.
Yes.
Now your home is no longer your sanctuary, so whatever stress you face at work, you're facing
It's
at
at
home. And now it's not just that you're working at home, but your kids are probably not at school or not at school every day.
Yeah.
So you're having to be a parent at the same time, a full-time parent, let's say.
Yeah.
Whereas before, at least you knew that the teachers were going to take care of your child for a certain amount of time.
Yeah.
You also don't have that escape in terms of 8 to 4, because we are hearing experiences of people work hours spilling over. There's not that much regulation now, and people are still expecting you to be as productive despite you having so much more on your plate. So again, that is adding to people's stress and anxiety and burnout. Then you also don't have the escape to go and see friends or family, or send your kids away for a little bit, just for respite. So all the usual outs are sort of been taken away.
Yeah.
So you're just in this constant pressure cooker kind of thing, where that is what is contributing to people's anxiety, depression, fear.
Must be very difficult. And we are obviously now also trying to vaccinate as many people as possible, and there are messages every day to say let's go out and vaccinate, but we've been seeing a lot of hesitancy. People are scared to vaccinate. Do you probably know why that is so, Dr. Boakye?
Yeah, so there's been a lot of conspiracy theories. From the moment anyone heard of there might be a vaccination in the works, conspiracy theories, WhatsApp messages, people talking on YouTube, or, just a lot of negativity around this vaccination. And one thing that we have to remember is that with every pandemic or epidemic that has been experienced in the world, a vaccination, or not every, but most of them, a vaccination has been rolled out.
Sure.
And it's been novel at that time.
Okay.
So polio vaccination was rolled out, and everyone is now getting polio vaccinations at birth. Same with hepatitis B, hepatitis, all of those things, the vaccinations are being rolled out. So the hesitancy is the fact that a lot of people have conspiracy theories about what the vaccination
Are they founded though?
Absolutely not.
Sure.
There's no basis.
Absolutely.
These vaccinations have been tested. And they've been tested, and they are minimal side effects that have been experienced by, people. So I think the benefit definitely outweighs the risk in this aspect. But South Africa is rolling out 2 main vaccines. The J&J which actually was part of the Sisonke trial, which all healthcare workers got.
Okay.
And I think about over 450,000 actually got the vaccination, which is amazing. And then we have to applaud the healthcare workers for being the first in line to receive vaccinations. The second is Pfizer, which is actually a two kind of vaccination rollout session. So you'll get a vaccination on the one day, and 2 weeks later you'll get the second booster.
Yeah.
And now I understand that SAPRA has essentially said there's a third vaccination that probably will be coming into South Africa. But the main two vaccinations we have is J&J and Pfizer.
Okay.
And both are actually equally as good in containing coronavirus, or in terms of rather preventing severe coronavirus or mortality.
Sure.
So I think it's advisable that everyone gets the vaccine, at least if you're over the age of 18.
Okay.
Yeah,
thanks, Darlene. So everyone should go out and, of course, when the time is right, register, go get your vaccine, and try to stay healthy. But another aspect which is very important is actually the interventions from the psychiatry and psychology point of view. What are some of the interventions, ID, you can give us?
Well, one is to try and control the things that you are able to control.
Okay.
So some people, there is a lot of worry about, will I get the COVID? What will happen when I get the COVID? Unfortunately, if you do get the COVID, the sequence of events that happens after that may not necessarily be in your control. At the meanwhile, you do what you can. You wear the masks, you have your sanitizer, you wash your hands, and you stay as safe as is possible, and hope for the best. Focus on the things that you are able to control. Also, try to keep a routine as much as is possible. So if you can do a little bit of exercise per day, that is always helpful. Eating healthy, setting aside time to engage with the family, especially perhaps without focusing so much on the pandemic and what is going on.
Just to talk about something else.
Enjoy normal engagement with your family. Also schedule video calls with friends, with family, and so on. Is that if things are getting, extremely out of hand, you are not coping, to reach out to professionals. Professionals are still available. People are scared in terms of leaving their homes, going to see doctors and so on. And if you are, luckily at the moment, because of how things have developed, teleconsulting has become quite a common thing. So it is still possible to try and arrange for teleconsult so that you can at least speak to a professional psychologist, a psychiatrist. Some medical practitioners I know are also doing consults over technological means and so on. So if one is really, really not coping with, just their support structures at home, then to reach out to professionals.
In fact, on that note, that people are scared to leave their homes because of COVID-19. Clinicians have seen a lot of people now who were previously having other comorbid conditions come in because they are not controlled. Diabetes is not controlled, hypertension is not controlled. What can you tell us, Darlene, about that?
I mean, we've seen so many people who have missed illnesses based on the fact that they've been isolating at home. And so whatever symptom they've been experiencing, they kind of underplay it because they don't want to go to hospital because I don't want to get COVID. And so we're seeing a lot of patients that actually have TB, number one, because TB is also a respiratory illness, kind of same symptoms of cough, shortness of breath. So we're seeing a lot of patients who actually do have TB. In fact, over the past week at Hotaskia, I saw 2 patients who had TB but had very much COVID symptoms. And they were tested with COVID negative, and it's like, what else? Let's test for TB. Had TB. And then other things like, myocardial infarctions, which are heart attacks, diabetes, which is uncontrolled, also strokes, because stroke can also be one of the long-term effects of COVID. So we're seeing a lot of patients coming in slowly but surely with missed illnesses, which isn't obviously great during this period because we want to optimize everyone's health, so everyone can have a good quality of life and be able to live as long as possible. But unfortunately, this is the circumstances that we're dealing with hospitals that are overflowing with COVID, and it's Yeah, it's a little bit of a
Look, I
balance of
must
both.
admit it's a lot.
It is.
It's a lot, but in as much as we are dealing with one pandemic, we don't want to leave other things
Of course.
hanging. So it sounds like Dr. Boakye is motivating us to go out.
Yeah.
You know, try. Of course, we want you to stay at home, but if you have to go pick up your medication, go and pick up your medication. It's one thing to be saved from COVID and you come with a stroke, or you come with whatever you have. And have you noticed the same patterns in psychiatry whereby people are defaulting their chronic meds?
Yes, people, as you said, they are scared to go to the clinics. Luckily, some clinics have been diligent with regards to delivering medications to the home, but sometimes this doesn't always work out. So we are having people that are relapsing and presenting with conditions that were otherwise well controlled until this point in time. But even aside from just the fact that COVID is affecting people in that regard, COVID is also affecting people in the sense that life is still carrying on. You know? But because of the isolation, the distancing, the government measures to try and prevent more infection, things are happening that are again putting people at risk of mental health issues. So people have unfortunately lost their jobs, people's salaries are getting cuts, but the bills still need to be paid.
Absolutely,
and the cost of living is going up.
Yeah.
So all of those things are really, really just, it's one issue after the other, unfortunately. It's almost like, being between a rock and a hard place. There's a lot of things going on at the moment. We're also having an increase in domestic violence or violence in the home, just because, again, pre-COVID, at least you would be able to escape from that home environment, maybe go to school as a child or as a wife, or because even men can be abused, you can leave the home and go to work or something, but now you are in a space where you are constantly having to be with this individual that is abusive, and it's unfortunate that in such a time even something as bad as that is increasing, but
it's very difficult. So I mean, like I said initially, emotionally, physically, mentally, we've all been affected by COVID. And I think just give us some encouragement, Dr. Boakye, as a physician and someone who's a frontline worker, just to try to motivate our people. People are losing hope. People are dying, every day. What can you just tell us as the people?
Yeah. So, I mean, of course, we're living in a pandemic, and we're going to be in this state for a while. We don't know how long. But COVID isn't the end all and be all of life, or as we know it. So I think at the end of the day, we want to have protective measures, but we still want to live our lives. I'm not saying go out, to clubs or bars or restaurants without, taking your precautionary measures. But take your precautionary measures, but still, do things that you love. Use things as an outlet.
Absolutely.
To just enjoy life. So hang out with family. But use your mask. You can always video call a friend. You can paint, whatever hobby
just do something.
is. Do anything, whatever hobby. Exactly.
Thank you so much. And Dr. Akpabio, from your point of view, what can you tell us as a way of motivating us?
I think it's good for people to remember that they're not alone. Right? Part of the difficulty with the pandemic is this uncertainty. Just when one wave is finishing, wave number 2 is coming. Number 3 is coming.
In fact, I saw predictions that October there'll be 4th wave.
Don't say that, Luyanda. Don't say that. But so that uncertain, we don't like to be, uncertain as humans. We like to know that, okay, if we were to know that, by the end of this July the pandemic is over, we'd be fine. You'd be like, okay, just hold on for another 3 weeks. We'll be good. So that uncertainty is what keeps people so panicky. We're in this constant fight or flight mode at the moment.
Absolutely.
But I think knowing that one is not alone, you are not randomly in your house feeling depressed while the rest of the world is not experiencing those same things. I think it can help one to feel, that it's not just you. And again, as Darlene has said, reach out to people. There's no need to be a hero. Call people, talk to people, make use of what is available in terms of support structures. If ever you needed support, this is the time. And
reach out. If ever you need support, this is the time. Thank you so much, guys, for coming to give us some wisdom today. We appreciate your gifts and your expertise. In fact, I think I didn't mention, she's a psychiatrist and she's a physician.
Yes.
They are both my friends and colleagues, and I'm always happy to have them. For viewers at home, we will have another session just to try to debulk all this information about COVID. It's a lot of information, but we have to talk about it slowly. And importantly, the message today was COVID is affecting our mental being and social being and everything, but we have to reach out to friends, family. We have to do things we love, and we have to carry on. But most importantly, let's stay safe. Let us use our masks. Let us sanitize our hands. Let us wash our hands, and let us stay blessed. Remember to subscribe, like, share, and what else?
comment.
Comment. Keep safe. Bye.
Bye.